Hello, you are listening to your Holistic Health Podcast by Akesis Holistic Clinic. I'm Dr. Homer Lim, and today we'll be talking about the foundations of cancer therapy.
So now we're gonna start with our principles of cancer therapy. Okay, so the number one principle here, in all cancer therapies, the number one principle that we really have to emphasize is detoxification. Okay, so you have to detoxify, right? Why do we need to detoxify? So usually, as we all know, patients with cancer, their liver, their colon, their kidneys are overloaded with toxins, right? So one of the things that we advocate and we teach people at the clinic is to detoxify. So there are many ways and many forms of detoxifications, right? So it could be an enema, it could be a colonics, it could be drainage massage, it could be herbs, okay, to clean your liver, your gallbladder, your colon. So it could be also homeopathic remedy. So there's so many forms and so many ways. Okay, so there's not only just one way. Okay, but very, very important before we do any form of treatment. Okay, we want to treat whether it's cancer, heart disease. You need to cleanse the body. It's like, kung yung drainage natin is barado, right? You don't, di ba? Hindi mo naman kailangan palitan yung the whole before you even change the whole piping. You have to make sure na malinis talaga yung detoxification organs, which are your skin, your lymphatic system, kidneys, your liver, as well as your intestine, as well as the lungs. Also, lungs is a very good detoxification organ. So that's part one. In part two of our principles of cancer therapy is actually the most important and yet the most not talked about and not emphasized. Okay, so this book again by Dr. Antonio Jimenez, his first chapter is exactly that. So the first chapter and the second part of our principles of cancer therapy is psychoemotional healing. Psychoemotional meaning if you have emotional, psychological issues, you need to correct them or address them properly. Because if your emotions or your psychological outlook is not good, let's say depressed ka, or you're angry, right? Or you're in denial that you have this cancer, of course, it's harder to heal, Just to give you an example, just a few days ago, I had this breast cancer patient. She's very good. All her scans were always consistently, negative, all clear, Suddenly, due to the lockdown, she started developing depression because she could not get out, she could not go back to the province. So the lockdown really put her into, depression. And so we did a scan or ultrasound, and the cancer came back. See, that's how bad being in bad emotional state, which is depression. So if you have these kinds of emotions, we really have to address them and address them properly and as soon as possible. Kasi whatever healing emotions, if your your psyche, the way you think is not well, or even your support, the family, if you don't have the support of the family, you don't have support, not only yung physical, emotional support, but also financial support, what we call financial wellness or financial stability. We always ask the patient, so okay, if you cannot afford it, okay, let's find a middle ground wherein at least kahit paano we are able to address we can address yung condition, we can at least treat you without being too yung stressed ba because of where to find the money, especially now with this lockdown. A lot of people, di ba, walang trabaho, hindi makalabas ng bahay, limited ang mobility, ang movement. So it's really hard on everyone, not just patients, even normal people. They find it hard to to adjust to the new, what they call the new normal. But I don't want new normal. I want to be the old normal. Okay, so that's number one. Again, detoxification. Number two, address the psycho-emotional profile of the person. Okay, number three, which is very very important, and one of the things that a lot of patients always fail. No, fail meaning they would follow this for a few months and then they go back to their original programming, and that is nutrition, what they eat. No, so we always tell them what you have to eat, right? What you can eat and what you cannot eat. So usually for cancer patients, we do not allow them to eat meat. Definitely that's a no-no for cancer. Then they should not be eating too much sweets, too much carbs, okay, too much saturated fats, which is meat. No, we advocate more fruits, not really fruits, more vegetables, phytonutrient rich vegetables. No, not too much of fruits, kasi some of the fruits are very very high in sugar also and fructose. So it's very important to limit that also, because that can spur more cancer growth. So nutrition, very very important. I cannot emphasize it further, that one of the things that's most important in any form of therapy, you have to get the right foods. Okay, if you keep on cheating, I have patients who cheats, I will know them almost immediately, because they are not responding to the treatment. So one of the things I will always ask when they come in for treatment is what they eaten for the day. The reason I ask that is not because I want to know. The reason I ask that is I want them to be reminded that they have to watch out there what they're eating. If I ask them, what did you eat yesterday or what did you eat today? If they cheated, then the back of their minds, isipin nila, I did not eat the right food. So that would give them an idea that they should not be eating foods that is that's not good for them, especially if you're already very very sick. So very very important is nutrition. Okay, so number 4 of our cancer therapy is our therapies. It could be IV therapies, it could be supplements, it could be herbs, could be minerals. No, so there are many forms of therapy that we can choose from, and we can offer. But of course, it depends on what type of cancer and how bad the cancer is. Or are they doing chemotherapy? Are they doing radiotherapy? So we have to consider those things, kasi before we then we make a plan of how to treat the person properly. So not everyone will be the same. There will be some similarities, but it depends, of course, with the type of cancer as well as the other treatments that they are undergoing. Okay, so we have 4 now: detoxification, emotional and psychological well-being. We have nutrition, then we have the IV or the oral therapies, no? And then lastly would be our what we call special therapies, no? It could be, so other things aside from what we do here, we also suggest, or we also would ask them if they can do like hyperbaric, meaning high oxygen therapy. They can do also what we call hyperthermia, or heating the body. So there are other additional treatments that we can offer, okay? Or we can also give them some form of what we call energy healing sessions. This is for our well-being, emotional, psychological well-being. No? So these are some of the things that we do at here at our center. So we also refer you or refer our patients to other centers if there are if that treatment is not available here. So we don't say na amin ka lang, no? So we always want to offer what is the best and most appropriate therapy. Okay?
Now I will read some questions from our listeners and answer them in this segment.
Johan is asking, how does heating help a cancer patient? Heating helps the cancer patient by making, when you heat the body, when you heat the tumor actually starts dying because they don't like the heat. Okay, once heat is applied, especially when it's over 39, 40 degrees, the cancer cell starts disintegrating. No, they start dying off. Okay, so that's how heat, like radiotherapy, that's actually no heat, but it uses radiation. But there are other ways how to apply heat to the cancer cells without actually harming the body too much. Okay. With hyperbaric, Johan asking, with hyperbaric therapy, how many sessions do a cancer patient need? Actually, it's not how many. It has to be in combination with other treatments. And then we, of course, after several sessions, then we do another scan to see if it's working. If it's working, then we continue. If it's not, then we do other therapies, no?
Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.